Hello, everyone. We're going live. Instagram is weird. There we go. Okay. Hey, there we are.
There we are.
Hello. Hello, everyone.
Hello.
Welcome. I am Dr. Nicole Smith, nurse practitioner at Anti-Gravity Wellness, and my guest today is Jessica Folgestrom. Oh,
Jessica Folgestrom.
Fogelstrom. All right. Sorry, she recently had her name changed back to the way it should be. She is the owner of Touch of Harmony Massage. She is my massage therapist. She's amazing. I will not go see anybody else unless I'm out of town, and then it's disappointing. So I wanted to have her on because she is, first of all, an amazing female entrepreneur. She's also working in the wellness space. I refer a lot of my clients to her. I work on the hormones and the internal and the diet and do a little bit of exercise stuff, but she will actually work on your body, which is also usually very pent up. Read the book, The Body Keeps a Score. It's a good one, and also very pertinent to the practice that she has. So I'm going to let you go ahead and introduce yourself, talk more about, what you do as a specialty, because I think that's very important and unique thing that you have to offer. And also, why did you get into massage? Because I think that's a very interesting story as well.
Okay. Well, like she said, I'm Jessica Folgestrom with Touch of Harmony Massage. And I've been licensed here in the Tri-Cities for 6 years. And I love my job. I love bringing pain relief and empathy to massage. I think that's important. So what brought me to massage? When I was a kid, I used to think I could heal with my hands. I would go up to my dad if he had a headache and just put my hands around his head. Don't worry, Dad, I'm taking your headache away, and it was always this thing that I just knew I could do with my hands. And anyway, life got away from me, and I ended up going into the dental field as a clinical assistant. And in that field, I learned a lot about empathy and compassion for people and soothing people's nerves and anxiety. And after ending up in the insurance billing side of it, I got burned out. And so I decided it was time to make the change and do what I originally wanted to do, which was massage therapy. So went to school, graduated at the top of my class, and then there I was as a massage therapist. During that period where I was in dentistry, I actually had a massive car accident. And because of that car accident, I was left unable to walk for 3 months. So that had a great effect on my entire body. And I still have, situations that occur, pains, discomforts, things I can't do because of that accident. So going through the suffering that I did go through, I didn't like hearing that other people were suffering too, because it sucks. And so I try to bring that empathy to my massage practice. I understand that you're in pain. I understand that it hurts and that, you might not have the energy to get up and do that exercise, or the emotional, response isn't there that you want because you're too busy suffering in pain, and that takes a lot of energy. Mm-hmm. So, anyway, so because of my pain, discomfort, and my healing journey, I thought that I could really bring something special to a massage practice. And then here I am. Now, with that dental background, I also saw a lot of people that suffered from TMJ disorder, which is something that I suffer from. So a lot of us are clenchers and grinders, and, a lot of us will get those chronic migraines or tension headaches. You can feel the side of your face cinching up, and that's from grinding your teeth and clenching. And a lot of that is stemmed from stress and anxiety.
Preaching to the choir.
And perimenopause.
And
so because of that dental background, I really felt like I had kind of an edge, in the game. So I went ahead and got my expansion on my massage license to provide intra-oral massage, which is where I glove up and I go in the mouth and actually work on those muscles that never get touched. So it's
I just recently started having her do that for me. And so like the first session, not going to lie, it was a little emotionally, but I was also really stressed out at the time. And I didn't realize how much of it I was holding in my jaw. And she wasn't even, it's not like she pushes hard or anything, but because I was holding it there and it was different. And when she pushed on just the right spot, I started crying. And I was like, oh, you talked about this. Okay, here we go. You just let it go. And I was like, that's that right there. That's that stressor that I was just talking about. There it is. And you just found it. So that was really, it was very eye-opening. And you talked about it before. That was one of the first things I remember you saying. We were in BNI together. That's how I met her. And that was one of the first things you said when you stood up and you said, I'm a massage therapist. And I'm like, ooh. And you're like, and I do TMJ, intra-oral massage, and it helps with migraines. I was like, what the hell? That sounds amazing. And yeah, it just really, really awesome. I've sent my friends to you. I've sent my family to you, and they all have rave reviews. And just the way that you're able to help people is so much farther than, oh, that was a nice, relaxing massage. Like actually making change. Like that's, I think that's what, yes, that's what really makes such, we were talking this morning, my father-in-law and my husband about physical therapists and how, we'll have Desiree on later, but sometimes some are better than others, and so, my husband Cole, he's like, oh, I've wasted so much money on these people, and, I can help myself better at home, and And I've had other patients say that, they've been hurt by some practitioners, and, so finding ones that are really good and really dedicated to their craft is so important. And you're definitely one of them.
Well, I appreciate that. Thank you. I too have had physical therapy where I was injured. After my ankle replacement a couple of years ago, I was doing yoga on my own at my doctor's recommendation before I could start. I had to wait before I could start my physical therapy. And then I got into physical therapy and I couldn't walk after. So, and it wasn't because she did anything wrong. It was just, I didn't listen to my body.
Yeah.
Which I definitely want to talk about today.
Yeah.
Listening to your body. But, I have so much respect for what Desiree does. Because it's like you said, finding that good practitioner that's a good fit, right?
Yes.
Because let's be honest, there's a lot of really great massage therapists out there. But are you connecting with your massage therapist in a way where they can understand where you're coming from and put that into practice in treating you?
Yeah.
And
building up that rapport. Like it took me a good 3 sessions with you, even though like I knew you and I like you, but especially with massage therapy, it's intimate, like
yes,
it's full, almost full body, and it was kind of the same thing as, when I go in as, a provider into the hospital setting, and people lose their privacy, and you have to be able to be very sensitive to that and help people to feel at ease in normally uneasy situations.
Yeah. Well, it's, you're accepting somebody's vulnerability when you're their provider. And with that vulnerability comes a lot of trust. They have to be able to trust you. And most of the time at first, people don't trust you right away because they don't know you. But as they see you, as they're treated by you, and as they're seeing the benefits of what you're doing and understanding what kind of practitioner you are, they're able to have that trust in you so that you can go further in their treatment and get them further with their results,
Absolutely.
So
yeah,
I don't know. I love that I get to help you.
Me too.
I know. I'm so thankful. Actually, I have amazing clients that really do. We do build that trust, and we do. I respect that vulnerability because I've been there too.
Yeah.
Right. And again, it's the empathy thing. I think that one of the major things in massage therapy is one of the markers of a good massage therapist is the ability to empathize with your clients. Not everybody's coming in for a little, oh, we're going to make you relax. We don't do that. A lot of it is, okay, this might feel tense. This might hurt, or excuse me while I massage your glutes, which a lot of people, most people are like, get in there, lady, but then, the empathetic side of me too, and the compassionate side recognizes that not all women want to go there. Yeah. And for various reasons. Yeah. And so you just have to respect those boundaries and make sure that your client is empowered to set the boundaries they need to set.
Yes. Encouraging them to be able to speak up, especially as women. A lot of us, I know I'm definitely guilty of this. Like, you just want to be nice and you want to be like sweet and you don't want to like, oh, I'm not going to, but being able to have someone who tells you like, no, you can communicate with me. I'm not going to take it personally. I don't think that you think that I'm terrible.
Yeah.
Like this is
Right.
this is a therapeutic relationship that we're building here. And you are a full participant in it.
Yes, exactly. Well, and even, I've had some teenage girls that have been clients. Their mom brought them in and, she's in the room while I'm providing treatment. And I have to explain to this teenage girl, this is consent. I have to ask your consent.
Mm-hmm.
And that's important.
Mm-hmm.
And I don't think these girls have ever received that from a practitioner before, because they're shocked.
Wow.
But
yeah,
where does it start? It starts with your medical treatment.
Yeah. I guess you don't really even think about that. Yeah. Well, we were talking to about, because I give her some questions before, just so we have a little bit of prep work done, and we kind of know where we're going to go. Sort of. I mean, not really. Obviously, I didn't schedule this, so you're welcome, guys who randomly stumbled across this live. So you're welcome. Someday I might schedule things out. So we were talking about how do we tie these into perimenopause. Well, it just so happens that we are of the age, so that helps. We talk about it all the time anyhow. And I'm a big proponent of teaching everyone that I possibly can about their cycle and being in perimenopause and the fact that it's coming around the corner. And if we're having these symptoms, you need to be aware that you're not crazy and you're not making things up. And if you feel this way, no, it really is happening to you. What I think is also really interesting and sad, honestly, we're not taught very much in school for whatever healthcare practice we go into, whether it's a nurse practitioner, massage therapy, physical therapy, doctor, anybody, not taught about perimenopause, taught very little about menopause. It's like a little blurb, and then we're moving on to usually talking about birth. There's lots of things about birth, and there should be. It's kind of a big deal, but there's this other thing that is our second puberty. And there was an analogy that I heard from another doctor when I was reading one of her books. I read so many books, I can't remember which one it was, but she was talking about how it would be like if you had a daughter and you took her in and she had just started her menstrual cycle, and you take her into the doctor because you don't know what's going on. And the doctor goes, yeah, I don't know. Let's just like put her on some mood stabilizers or something. It's like, it's almost
That's
like that.
Scary.
like the level of education around it is, that's it. Like, and that seems crazy to us, right? But that's what's kind of going on with perimenopause.
Even with our cycles, it's going on. I mean,
get me started on that.
Like, I just learned what the luteal phase is. So, and I'm 43, and I'm in the medical community. So I'm like, oh, I should probably look into that some more.
Yeah.
But yeah, we don't, in massage school, we didn't go through the cycle unit or, the menopausal, perimenopausal unit in school. No, we went over the reproductive system and the basic functions, obviously, which, I learned that in high school anyway, high school health class. But other than that, we really didn't have any specialized training in it. I have not seen any specialized courses in it.
Opportunities. We're gonna make many courses.
Yes. Well, and so as a massage practitioner, I'm getting ready for this conversation, and I'm looking, for information. Just, hey, is there anything that is specified that I haven't learned yet? Because obviously, practice means you're always learning.
Oh yeah, yes, always.
And I came up with some things that actually I really didn't know or didn't think about.
Yeah,
how massage can help perimenopausal and menopausal women. So
do tell.
That's exciting. I've got notes.
Pull up your notes.
So obviously, massage therapy helps with things like circulation, muscle tension relief. And so there's a lot of side effects from that stuff, right? So a lot of different things that those things help with. But one of the things that was on the list was relief from muscle tension and joint pain, right? So hormonal changes will cause joint pain, muscle pain. Yep. So when I'm going in and massaging somebody, I'm actually lengthening and broadening that muscle, which actually relieves that tension on the joints, which is really nice, right?
Mm.
But what we're also doing is we're increasing the circulation. Now, the lymphatic system is linked with the circulatory system, right?
Mhm.
So you have your venules and your arterioles, and they have that space in between them, and that's where the interstitial fluid sits, or the lymphatic system. When your pulse goes, it pulses, right? And it allows the exchange of the nutrients and the oxygen and deoxygenated blood, and that's how your body kind of cleans itself out. So when we're increasing your circulation, we're also working with your lymphatic system, which means for perimenopausal women, right? Let me bring back my notes. So as estrogen levels decline, circulation can decrease. So when we're bringing that back up, it encourages healthy circulation, lymph flow, and helping the body to eliminate those toxins more efficiently, which we already feel like crap when we're in perimenopause. So if we can accelerate that release of toxins, we're going to feel better in general, right?
Yeah, absolutely.
A lot of us get like headaches, right?
Yeah.
So, and for various reasons, first thing I always do is tell myself, Jessica, have you drank enough water today?
Yeah. Step one.
Step one, evaluate your water situation. Yeah. But a lot of us, because we are going through, drops in serotonin, dopamine, all that kind of stuff, we have that raised cortisol levels. That's something that, we all have raised cortisol in the world today anyway, right? But the more I research this, it's okay. Well, perimenopausal women have a spike in cortisol, so we need to, be able to regulate that. And massage actually does help with that. But one of the side effects from that is migraines or headaches. And when I can get in here and work the jaw muscles, I'm alleviating, again, lengthening and broadening those muscles and allowing less pressure on the joint. And we're also soothing the nervous system. So
need that.
Right?
Yeah, that's huge.
We need to be comforted. And us as women, we really need to be comforted, especially when we're going through these changes.
Oh, well, we comfort everybody else.
We comfort everybody else. Exactly. And part of our self-care should be comforting ourselves.
Yeah.
And so having a good massage therapist to help with that, it's fantastic. Yeah, we're getting in there. We're working things. There might be a little pain. There might be a little not pain. I don't know. But basically, we're activating your parasympathetic, your rest and digest nervous system. And so when we do that, you have that anxiety relief. You have that lowering the cortisol levels, and you're able to have some peace so that your body can actually do a little recovery.
Yes. Yes.
So that's really important.
Absolutely. Yeah. I talk about that too. I've been coming on here a lot talking about muscle and metabolism and how estrogen is an anabolic hormone. It's a pro-circulation hormone. It's a insulin regulator. And when we start to lose the estrogen, we need to have other ways that we can go in and make those changes. So like strength training is a great way to build muscle when our estrogen starts to decline. So it becomes even more important as we age that we do some type of strength training, some type of resistance exercise that continues to build that. Same thing with the circulation issue. So if we're losing our estrogen, our circulation isn't as good. What can we do to improve our circulation? Well, exercise is one. Walking and drinking enough water, and then going to see Jessica, getting your massage.
Yeah. Well, and massage, because menopause and perimenopause also affects the skin. Yeah. We're concerned about aging, right? Yeah. So massage, while it increases that circulation and it increases the detoxification, it can also, help with collagen production because you're getting that blood flow back in there. You're getting those healthy nutrients back into the skin. So you might notice a difference there too.
Yes, absolutely. So you just recently had more training because she's like me. She's constantly learning.
I try to be.
You are. You're so great. So you were talking to me about this new training that you had and kind of work the ribs and everything and get those back in order, but more talking about the fascia layers. Because when I was looking into why do we get injured, why do we have these areas that, like, I have terrible knees. I'm I'm trying to avoid for the rest of my life not having to have knee replacements. I got some genetics working against me, and also I played volleyball and was kind of hard on my body for a while. So I do have some issues there. But how do we loosen up that fascial tissue, because it's coating everything. It coats the muscles, and then we've got, you know, the layers that are in our internal organs and around our heart, and everything from head to toe, like it's all connected. So when you have an imbalance in one place, it bleeds into everything else, which is actually a good thing too, because if you work on one thing, I used to do like Dr. Kelly's supple leopard stuff. And I'm like, it's going to take me all week just to get through head to toe. And then I'm going to have to spend like hours on this. But and he even says it too, working on even just one area and getting really, really dedicated. So even if you don't have an hour and a half, like I haven't been able to do a full hour and a half lately, but just working on one area. And of course you kind of want to prioritize, where does it hurt? Let's kind of focus on that area that's really giving us, like barking at us, but it will help the rest of the body. So I don't know if you want to talk a little bit more about that.
I definitely preach full body massage at every session. Yeah. And even with this latest class, even my practitioner that I learned from doesn't do full body every session. A lot of practitioners don't. Yeah. The reason I do is because I come from an injury standpoint. And I know that after having massage therapy 2 to 3 times a week for 3 years to recover from my car accident, I needed full body, because we would work the injury site so much, so frequently, because it was the problem, but everything else that was compensating was compromised. Yes. So that's why I preach full body massage every massage. But then I also recognize not every occasion is that necessary. You know, somebody who's regularly coming in and getting that full body massage on a regular basis, you know, that's great. But if you're going to have a specific issue, like with your shoulder, for example, and it's really causing problems, you're not sleeping well, like, you know, let's get that taken care of, and we can go back to full body at a later session. But it's I lost my train of thought.
It's okay. So we're
gotta love lives. So
fascia layers.
Yeah. So the fascia is, well, first of all, the whole body is connective tissue. So even starting with the bones, right? The bones are porous. Yeah. They have small little tubules, which, if you know anything about architecture, those rounded tubules strengthen the bone, right? And then the bone has the outside layer, which is the periosteal layer, right? And then it goes into the ligament, and then the ligament turns into the tendon, and the tendon turns into the muscle. All the while, fascia is running through all of it. All of it. So back in the day when they used to do surgeries, they'd cut out what's this piece of junk? It's just a bunch like of connective tissue, whatever. And throw it out. But now we understand that connective tissue actually does have a job. Part of it is communication. So there's a video online that you can watch where you look at fascia under a microscope, and it's literally like fiber optics filled with water. Yeah, it's totally cool.
So amazing.
And the fascia can change shape. So if I go in there and I'm pressing on let's say I'm just pressing on your back, and I'm just applying a little bit of pressure and movement, what I'm doing is I'm stretching that fascial tissue and breaking those bonds so that it can form new bonds in a new shape, right? When you have injury, the fascial tissue thickens around it because it's protecting it. The whole body's communicating with itself, right? And it's saying, okay, this shoulder is a problem. I got to protect it. I got to immobilize it so that it can heal. But sometimes the body works against itself.
Right.
Right.
Hence autoimmune conditions.
Yeah. But while you have this area of injury, let's say, and that fascia is thickening, it's also pulling on something else, because that fascia is hooked to something else. Right. So for example, I've been having some pressure in my chest. It's not related to my heart, but it's because my ribs. And my ribs and the fascia that's connected to my ribs is pulling on things that it shouldn't be pulling on. So I can get in there as a massage therapist, work in the ribs, work up underneath the ribs, and alleviate that fascial tension, thus making the pressure better, you know. And I'm saying pressure, please go get your cardiologist appointments, ladies, and perimenopause especially.
Also a problem with the estrogen dropping.
Right? I know. Things were not taught, you know?
Yeah.
So yeah, your cardiovascular health is very important. But anyway, so yeah, the fascial system literally runs, you know, head to toe. You've got weird things connected to weird things. You know, I've had migraines where I suddenly get pain in the roof of my mouth that goes down to my lower vertebrae, and that's a fascial line.
Yeah.
You know,
That's
trigger
that referred
points
pain, yeah.
could actually, they did a study, I just learned this in the class I took, and trigger points, they cannot prove, what was her name? Trudell. Anyway, they couldn't prove her theory on what trigger points were, apparently. So what we think they are is actually the fascial line. So it's the fascia in that sore shoulder connecting to the rib cage or whatever. And that's why you have that referred pain.
That is so key. That is so key. I remember, especially for medicine, like hospital medicine stuff, where we have like deep internal organs are sick, damaged, something going on there. And we learn about referred pain. So you've got a weird pain that's in the back. It has nothing to do with the back. There's actually an internal organ that is unhappy. And then we run labs and everything. We find out, oh, okay, well, your gallbladder shot. Okay. So, and it doesn't really make sense as far as like the pain isn't there. It's coming from someplace else. So the body does amazing things. It's like, you know, typical heart attack symptoms for a guy. Not so much for women. Women are weird. we're special.
Are we the weird ones though?
I know, right? Maybe. We're just we're extra.
We're just complex.
Well, studies were done more on men. So men, when you have that referred pain, you know, pain down the left side, and then we're like, oh, especially for men, that could be a heart attack. I had a woman, and I think I've talked about this story before, but it was just so dramatic for me when I was still working as a floor nurse and I was in the cardiac unit. So I had all the cardiac patients coming through, and a lot of them had heart caths, and some of them we'd do a heart cath and be like, oh, we're shipping you to Catholic because you got to go or the other hospital, sorry, because you need a cabbage, like you need open heart surgery. And those were always exciting. I was like, okay, let's go. Time's the ticking. But we had this one lady who came in and she had already had 2 heart attacks. And she came in on her second or third one. I can't remember which one it was. And she was just bebopping along, and she had a heart cath and she was better, and they put a stent in and she was okay. And we were literally, I think I had just taken out her IV. I was sending her home. And I just took out her IV, and she grabs my arm, and I'm like, what? She goes, my ear hurts. And I was like, okay. She's like, no, my ear hurts like it did the first time I had my heart attack. And I was like, oh God. Wow. And sure enough, she was having a heart attack right there, right in front of me. I was like, oh my God. Like, she was totally calm. She was just like, shit's happening again. Wow. Just crazy ear pain. So it can be something so random, like these referred pains so just again, emphasis that the whole body is connected. I want to talk to you too about women's intuition. I had a friend of mine, and this was more of like a mom's intuition, but still women's intuition. And then when you have babies, it gets even more intense. But women's intuition, because women go to any provider or talk to really anybody, and it's so common to get dismissed.
Yes. It is.
And you've been through some serious health things, you know, the car accident, everything like that. And you've had to have this major surgeries. Tell us more about like your experience, if it's okay, if you feel comfortable doing that. And then how do you then approach because of your experience, then you've got this new empathy. How do you approach your clients because of that?
It's a really good question. Really good at that. Yeah. Well, okay. So, boy, where do I even begin? So, intuition. Personally, because of everything that I've been through with my body, I've learned to really be in tune with my body. So when I get weird ringing in the ear, you know, I'm like, oh, I need some intra-oral massage because I know that causes tinnitus when you're all cinched up here. So, you know, there's certain things you just learn to listen to your body, but you know, I recently had an experience where I had talked to my provider about something specific going on, and she did dismiss it. Oh, no, this is something completely normal. And I had to advocate for myself. And I said, no, this was not normal. This was an episode that I need checked out. and just reiterated and really stood my ground with my provider. No, I need a referral to a specialist for this. And of course, she allowed that, and I'm still waiting for that to continue. But that intuition, where does it come from, right? I mean, is it that you do listen to your body really well, or is it part of it that gut instinct, right? Where, is it you listening to the aches and pains around your body and how your body feels, or is it you listening to the higher self? And I'm still learning how to do that, honestly.
I feel like it's connected.
I think it's connected too.
Yeah.
And the more I listen to, some podcasts and read some materials about it, it's definitely all connected. And even like the intuition between a mother and child, they're finding that those DNA links, there's actually, there's a study done, and I am not a scientist by any means. So this is a very generic version of the study, but basically you've got one particle and you've got another particle, and they move in sync and they are nowhere around each other. Yeah. And it's the same thing they're finding with like a mother's intuition with her child or twins.
Oh yeah.
It's that genetic link that actually allows them to exist in the space-time continuum at the same time doing the same stuff. I don't know, something like that. But it's interesting. I mean, there's so many different avenues we haven't figured out. Yeah.
No, there's so much we don't know.
There's so much we don't know. Yeah. And every day when I go into my massage practice, I learn something new from my clients and their response to treatment or their response after treatment that they tell me about. Like, we're always learning. And I think that your intuition, part of that is just that information that you're programming into your own brain as you learn. Like me intuitively knowing, hey, I know I have a history of this in my family, that I've got a suspicion and I'm going to follow it.
Yeah, until proven otherwise. Yeah.
And definitely advocating for yourself, especially in perimenopause situations and menopause, because the providers are not, unless there's somebody like you who has done the deep dive and really done the work.
Yeah, I didn't know this coming out of school. I didn't know this being a hospitalist.
Yeah.
No. And until I started going through it myself and had clients that had issues, and we tested their hormones, and I'm like, oh, okay, let's see what we're going to do about this, and tried a couple things. And I ended up sending some people to endocrinology because I wasn't versed enough. I wasn't trained at the time. And now I do have the training and I feel a lot more comfortable. I'm, nowhere near the level of some providers have been doing it for 20 years or whatever, but
don't kid yourself. You're amazing.
But I use that a lot. And I was always taught that, at least, and maybe that's coming from a nursing background, but part of the assessment of the patient coming through the door is one of the questions we ask them is, what do you think's going on?
Yeah.
And okay, yes, maybe Dr. Google freaked them out. This is the thing. Not everything is cancer. But
it's not a tumor. That's what I always think.
But at the same time, when you have something going on, and especially when it's not going away or it's getting worse, and you've tried to find help and then you're told that, oh, nope, it's not there. Everything's fine. You're like, yeah, I don't feel fine. Being your own advocate and knowing that you're not, I think that's why it's so important that we do have these conversations, is that you're not crazy. You're not making stuff up. There's a few select people out there that are really like hypochondriacs, but most women are not, and
we just know when something's off.
Yeah, we really do. We're taught to be more in tune, and then we're taught not to, that we should push it down and ignore it. Men are definitely a lot worse than we are. So, really feel sorry for them on that level, but
yeah.
Maybe that's part of why they don't live as long as we do. We tend to take better care of ourselves and everything, but it's really frustrating when we are told that it's just getting older and you just have to suck it up, and this is just the way that it is.
Well, and I also think that there's a lot to be said for finding providers that understand and recognize they don't know everything.
Yeah.
I don't know everything.
Yeah, me neither.
I don't, even about massage therapy, I don't know everything.
You can't.
And so knowing that your provider is going to get you in touch with the help that you need in the direction that you need it if they can't help you.
Yeah.
Because I think a lot of times ego gets in the way in
Yeah.
I'm sorry, it does. Ego can get in the way in the medical profession.
Yeah.
You know, it's just like me. If I feel like, you know, no, I should be able to fix this problem, so I'm just going to torture you. I'm going to tear your tissues apart to fix this. You know, that's a me problem. That's not a problem with your body. So that's me needing to say, you know what? I think this is out of my scope, and I think that you need to go see a doctor.
Yeah. Or
Or
just
Nicole,
currently out
who
of
is a doctor.
yeah. Well, and you know, I thankfully had that support working in the hospital setting where it was expected that I get a bunch of referrals. You know,
Yeah.
I'm calling in the cardiologist, I'm calling in the nephrologist, I'm calling in oncology, you know, all the time. So we were always, or, you know, orthopedics, you know, and ended up working with those guys more closely, which they're awesome. I love the orthopedic surgeons, but
I do too.
they're so great.
I love them so much. I have a lot of experience with orthopedic surgeons.
They kind of are the pros of the medical space.
They are. They are.
I just love them. And they love me because I do all this stuff they don't want to do.
Same girl.
Yeah,
Same.
yeah. But being able to accept your limitations as a provider, it's really hard because you're taught that you have to, you're held to such a high standard.
You are. Yeah.
Such a high standard. Like, and it's really, really difficult. And that's like a conversation for healthcare workers that we don't necessarily need to get into because it's kind of more broad for everybody. But it is very difficult. But having somebody who is humbled enough to recognize that. And that's part of why I formed the group that I did, because it was a little bit selfish. Okay. I needed a group of people that I could also commiserate with.
Well, then I'm selfish because I'm in the group and I wanted it too. Right. But, you know, with that said, you know, forming that group, you know, having healthcare providers that are linked together, that work together to help each other be better at their jobs. Incredible. And if it wasn't for, you know, you and Betty specifically, Betty McLean does like Aim for Greatness coaching. And I had a client in particular that I ended up, you know, she was suffering through, you know, she was unable to get herself to calm down and out of her head. And she's telling me all of these issues that she's having, all these problems. And I just said, you know what? I think this is in the scope of Betty. That I need to refer you to Betty so that you can get, you know, the help that you need in that area. And it will work together in this area. The body and the mind, they work together. And so if we can help, you know, change the way that we're approaching ourselves through that coaching, then we're going to have a better result in the massage therapy room too. It's so huge. Know, I mean, because we can't expect one provider to fix everything, right? They can't expect you to fix everything about them.
Yeah. Like, well, and that's why I specialized in perimenopause. When I first started this, you know, my own little practice here, I was pretty broad and I was trying to do everybody because I want to help everybody. Like, it comes from a good place, you know.
She has a big heart.
But it became really cumbersome. And there's like, oh, well, I have to take this specialty class and then I need this certification and then a little bit of imposter syndrome that I never know enough and I will never know enough. And that's just going to be until I die. And then I will know all, I guess.
That's right. That's the next level.
Yeah, right. But that is part of why we specialize, and that's also why we build a network of providers that we can all talk to each other, refer to each other, get, you know, curbside advice on this or that. I've got this client and this is what they're struggling with, and I need, you know, a little bit of help with this. And, you know, people ask me all the time too, like, you know, is this perimenopause or they've got this hormone issue and what do you think? And I think it's so good that we have other providers that we can talk to and get our clients the help that they need, because that is the ultimate goal. That's what we really want here. It's not to prove that to ourselves and our ego that we are so amazing and we could do everything for them. I wish I was a one-stop, only because it would make it easier for them. I wish that we were all in one building to make it easier for you guys, but it's you know, unfortunately we're all spread out a little bit. I went telemedicine to make it easier on so many levels. Right. But when you have, you know, physical touch, obviously you have to go to a place and have that done. So
I could do it via Zoom.
Right. Well, I mean, there's ways.
I did see a video where somebody was charging somebody for a massage and they were just doing this via Zoom.
Some people don't like being touched. I don't know, Jessica.
I know. It's a thing, I guess. Zoom Reiki.
Zoom Reiki. Yeah. Yeah.
No, but you know, it's definitely a way that I view myself. I'm not a healer. I'm a facilitator.
Mm-hmm.
Because what I do is I bring some tools to your game and allow you to tweak your game so that you can function better.
1000%.
And because your body is this amazing instrument that we don't even know half of what it does, really.
Yeah.
And so when we can do things like, you know, up your circulation, just that little bit of help can make a world of difference and make you feel like you can conquer the world, even if it's only for a day or two. You know, at least you're able to feel better and your body can go into that recuperation mode, that healing mode.
Yes.
Because that's what it does on its own.
Mm-hmm.
We're just trying to figure out how to help it.
Exactly. No, the body wants to heal. It wants to be whole. It wants to heal, but we have so many things working against it. And a lot of people don't even know what those things are. So again, also why we have these conversations so that you guys know, you know, if you have migraines all the time, well, first of all, I want to know, are they around your cycle? I'm going to have you track. So we're going to figure that out. And then we're also going to ask you your hydration level. And then we're also going to say, you know, how are you sleeping? Are you clenching your jaw? You know, do we need to do physical therapy? Do we need to do massage? Do we need to go to a chiropractor? Like, what do we need to do to get you to that point? We're going to keep working with you until we figure it out. And I think that's the big difference between some other places that you go, especially that are, let's talk about insurance. It's a great segue, by the way.
You know,
so I do not bill insurance. I will provide
either.
a super bill. Jessica does not bill insurance. And this is a big reason why, because we are hogtied when we do that on what we can do for our clients, for our patients. And especially me as a provider, and I'm sure same thing, the reimbursement and then the delay in that, it could be months before we're actually paid for a visit that happened a long time ago. And then we're restricted on how much time we can spend with a person because you're not making money and we got to eat. Like literally we just need to eat and keep a roof over our heads. And when that becomes cumbersome, it just seems silly, you know? So it's very hard to have that conversation sometimes with people that really want to use their insurance.
Yeah. My approach to the insurance side is I explain to every client that, you know, yes, I think everybody should be able to use their benefits. Unfortunately, me being a single practitioner, I don't have time to fight the insurance company to pay me for something that should be covered. No problem.
And it is a fight.
And it is a fight sometimes, you know. You could have all your, you know, I's dotted, T's crossed, and they'll find some reason to deny it. I had a client who was billing her insurance for 6 months, and all of a sudden she gets all these EOBs that say that she doesn't have out-of-network benefits, so she can't bill for a service that I was providing to her. But also under her plan, you know, she can only see certain providers at certain places, and there's not very many that she has access to. So they limit the access because they don't want you using that benefit. Or like when I was married, my ex-husband's plan covered massage therapy at 100% if it was provided by a doctor or a physical therapist, neither of which are licensed to provide massage therapy.
So just like make things up.
So then it forces the client to pay for it anyway. You know, and if we do bill insurance, you know, you have the negotiated rates, which are lower. You have lower reimbursement, which means we have to do double the amount of work to get paid less. Which means I'm spending more of my focus in the front office aspect of things rather than in the hands-on, you know, position with my clients.
Helping the people that we're here to help. Yeah,
so
absolutely. Yeah, it's really frustrating. I understand the frustration on both ends. Absolutely. But unfortunately, it's coming to the point where we do need to start thinking of I love the HSAs and the FSAs. I think those are brilliant, especially the HSA. like tax benefits in there. But being able to have a little bit more flexibility with your spending, it's your money. Like, and that's the kind of the crazy thing. Like, and I understand why people get so frustrated because it's so expensive to pay into health insurance. And then it doesn't cover anything. You're like, yeah. Like, what am I paying for? Yeah. But you still kind of need it because what if there's, you know, an emergency,
catastrophic events?
Oh yeah, yeah, and you definitely need it for that because you go to the ER and that's a good $5,000 right there, just walking through the door, and they're like, "Here you go."
Right? Yeah.
Yeah. So, and I think there's some benefit though to being able to pay for things like this up front. First of all, transparent pricing. You're not ever going to wonder what we're charging because it's right there.
It's right there.
So there's no surprise, and then you can budget for it. You know, you can work it into it. So I was actually just talking to her about this yesterday, how like we're rearranging some things. I still have some student loan debt and I'm like, I'm done with this. I'm getting rid of it. So we are making some choices, and it's not that we can't afford things. We can afford lots of things, but we're making choices. But one of the choices that I'm making is to keep my monthly appointment with Jessica because it is self-care and it's important to me. And no, I can't use my insurance, but I don't care. And I know there's people out there who are not in a position to do that, and that's okay. But we all make decisions. We buy coffee, we get our nails done, we get hair done, people do their eyelashes, like, and they spend money on their clothing. Like, so you are spending money, you are prioritizing things. You just need to look at what you're prioritizing. And sometimes, especially when you get to that point where it's like, this sucks enough that I want to do something about it. I think that's what I really try and provide. And I think that, you know, same thing with you. You're not going in there just to get a treatment and then, okay, that was nice, you know, like Elements massage or whatever. Sorry, shouldn't be dropping that, but one of those other massage mills, that you're actually, you know, benefiting them in a way that they wouldn't get otherwise.
Yeah. Well, and I think too, now that you've brought up the big bag box massage places, you know, one thing that I mean, being local business owners, we're always support local. But there's another aspect to that. When you are supporting a local, say, individual massage practitioner, you're actually providing for her and her family, or him and his family, right?
Yeah.
And aside from that, a lot of us, our price structures are different than, say, one of those box places. For example, you know, at e-massage, you might have a $20 add-on for cupping, a $20 add-on for hot stones. You know, I recently was discussing the intra-oral massage with somebody, and they said, I would never have normally tried that. I would never have normally tried cupping if I had to pay for it. Right? But because I don't charge extra for services, I just charge for my time and expertise.
Yep.
So I provide what my knowledge and background and intuition tells me that they need, or what they tell me that they need. And I don't worry about the rest of it because it's all inclusive. So there's no, hey, I really think you need cupping. Do you got an extra $20 today? It just doesn't, to me, it sounds wrong.
Yeah.
And no disrespect to anybody who does price that way. Practitioners are going to do what they do, that what's best for them and their clients, and that's fine. But in my practice, I really feel like it's important for me to be able to have the flexibility there to do what the client needs versus what the insurance wants and what the pocketbook wants.
Yeah.
You know, and yeah, upselling drives me nuts.
I know. Yeah.
Yeah.
Oh, yeah.
We covered a lot.
We did.
I know I missed something too.
I don't know that we missed really anything. Let's see if there's any. Okay. Cool. Not missing anything there. We have been chatting now for about 15 minutes. So
Wow.
We got some hearts. We got some people watching. Thank you so much for everyone
thanks for watching.
tuning in and out. I know it's busy.
You know, I want to say this to your listeners. Since knowing Nicole, I feel like I've upped my game in my personal care, in my practice, because I have a great influence in front of me. You know, you're always learning, you're always growing, and you're always just in the know on everything. And I elevate myself by associating with the women that I'm surrounding myself with. And you're one of them. And it's just like that group, it's something where I feel so enriched every time that we get together and do something like this, because it's nice to have these conversations openly. I don't remember discussing this stuff growing up. I don't remember discussing this stuff, 10 years ago when I was in dentistry. And, it's nice that we have practitioners like Nicole who are facilitating these conversations so that everybody in the public can access information and understand their bodies and help themselves,
Yeah.
So it's incredible. I just love what you do.
Oh, thank you so
You're just
much.
such a wonderful person.
Thank you.
I did a heart.
That's always something that I think that's why nursing has been such a big thing for me. Because nurses are teachers. I freaking love teaching. I just love it. I love that I get to come on here and do this, and I've got these platforms that I can teach on. I remembered being like a TA. It was the most fun I ever had. Like, it was just so fun, especially little baby nurses that are like just bright-eyed and bushy-tailed and like an IV scary. And I'm like, yeah, we're going to do all this too.
Right.
You got this. It's really fun. And I love talking to people, like the patients. And I would get recognized by the manager because the patients I would always follow the doctor in the room. And it is so funny because I'm like, they're not saying anything different than I'm saying to you, but it's the white coat syndrome, and it happens with me now that I'm a provider too. I'll walk in and I'm like, okay, let me make sure you understand what I'm talking about here. But I think it's worse with like the surgeon, than it is with me. But you'd walk into the room, listen to what they say about this is what's going on with you, here's the treatment plan. And then walk out and I just stand there and go, okay, what questions do you have? And they're like, I don't understand anything. Okay, so this is and just re-explain everything. And sometimes go into a little bit more details. Like, for instance, I had a guy who had congestive heart failure. He was in the hospital again. He really didn't understand what was going on. And I was like, you're just going to come right back, dude. So I sat down with him and his wife and I was like, this is your medication. This is your scale. This is what you have to do. What's going on? Your pump is not pumping. Okay. So what happens when a pump doesn't pump? And he goes, water gets backed up. I was like, yeah. So your water's getting backed up in your body. And he goes, oh. And I'm like, yeah. So your weight's going to go up. He goes, oh. So like the things were finally starting to click and, being able to talk to people in a way that they can understand it. Because I really believe like it worked for me so well. When I understand something, I'll do it.
Yeah.
So don't just tell me what to do. Tell me why.
That's actually a really good point. Do we have time real quick for me to share?
We got all the time in the world.
Okay. So I came to Nicole for my own sake because I struggle with my weight and I struggle with IBS. I've struggled with IBS since, I was diagnosed when I got my gallbladder taken out at 23. Did anybody tell me what IBS really is? No. Did anybody tell me what kind of foods I should really? I mean, I remember them saying like, "Oh, avoid fatty foods." And I'm like, "Isn't that everything in American food? Am I allowed to eat?" So in our workup, I was educated. Guess what? You have inflammation and bloating in your abdomen, and that's why you got a big tummy. Which made me feel way better because it wasn't just a fat layer. Like everybody just says it's a fat layer, right? No, there's actually dysfunction going on. And you helped me discover that. And going into perimenopause, now that I understand what this is and how to combat it, I'm set up for more success going into perimenopause, because reducing that inflammation is going to help me feel better overall.
Yes.
Which also massage helps with inflammation, just FYI.
It sure does.
That circulatory thing, working with the pump.
Yes.
But yeah, it's, having a provider that you can learn from, I think is really important. And it's the same thing when people are always asking me when they're on my table, like, hey, why does blah, blah, blah hurt?
Yeah.
Or, hey, why is this happening? And okay, well, let's talk about what's going on in your muscles,
People want to know.
People want to know.
Tell the people what they want to know. All right, guys. Thank you so much for joining us today. I will also be turning this into a podcast later, so stay tuned for that. If you are catching the replay, then definitely drop a comment below. Tell us that, say hashtag replay. Let us know you watched it. And if you have any questions or if you'd like to know more information about Jessica and her practice, I will actually be dropping that also in the comments. So you can make an appointment with her. She is booked out, so get in there. She's located in Kennewick, Washington. You do have to come see her, unlike me, where we can just meet via Zoom.
Please don't Zoom me.
Don't Zoom her. All right, guys. Thank you so much for joining me. And this will definitely not be the last time we have Jessica on because we got lots more to talk about every time we get together. We
Every
can
time.
talk like all day. So yeah. But we'll cut
It
it
was
off.
my pleasure to be on, and thanks for tuning in.
Thank you, guys. See ya.
Bye.
Bye.